Experiencing difficulty conceiving can bring up a lot of hard emotions, and it can even contribute to the development of and the exacerbation of mental health challenges, which is something that I really don't think we talk about nearly enough, which is why it was so important that I bring this interview to you. I just interviewed Lyla Wakut, who is a psychotherapist who specializes in perinatal mental health. And we talked all about anxiety and infertility. She shared some amazing information with me that I'm so excited to have the opportunity to share with you. So let's dive right into this interview with Lyla Wakut. Hi there, Lyla. I'm so excited that you are joining us today. So we're going to dive right in because I've already told people a little bit about you, but I'd love it
Okay,
if you could tell us in your own words who you are, what you do, and why you do it.
perfect. Yeah. So my name's Lyla. I am co-founder and a psychotherapist at Crescent and Crown Therapy. We opened our practice, Ashley and I, last year in October. And our story actually begins on a maternal child social work team at a hospital. Ashley and I worked together, and I was the NICU social worker on the team. And being the NICU social worker really allowed me to be a part of the postpartum stories of a lot of families who may have experienced birth trauma, who have experienced, really long NICU stays and dealing with perinatal mental health along the way. And so when I did that, I was the psychosocial support, right? Like I was giving hands-on resources and support in the moment, but I realized that I wanted to be able to do more. And so that's what kind of shifted my work from being a NICU social worker to perinatal mental health.
Mm. Ashley used that word perinatal the last time we spoke. And so, just in case anyone hasn't watched that interview, can you define what perinatal is, what it means?
Yes, yes. So perinatal basically is anything dealing with in or around pregnancy. So when you're thinking about before and you're trying to conceive and kind of planning for your future and having a family, and when you're actually pregnant, the labor experience and postpartum.
Oh, beautiful. Thank you so much for clearing that up because I think
Mhm.
it's a word that gets thrown around kind of like postpartum. And I don't always know that people know exactly what either of those terms mean. So thank you for making it clear for us. So perinatal includes the preconception stage as well. And so that's where you and I are really going to focus our attention. So something I've heard, and I haven't verified it, but I've heard that anxiety rates are extremely high in those who are experiencing difficulty conceiving. It can be as high, from what I've read, as high as those who have received a cancer diagnosis. And so, in your clinical practice and in your experience, have you seen that to be true?
Yes, because it's the fear of the unknown, the uncertainty, right? Like you're struggling with a medical condition that impacts your future, right? And there's a lot of emotions that come with that. And worry is a natural feeling, but we see that it comes full force and it impacts sometimes the ability to function, right? Because you're working with all these medical providers and you're worried about, well, can I do this? Can my body do this?
So there's lots of uncertainty there. I'm wondering if you can tell us the difference between when you're just experiencing worry and anxious thoughts, which I feel is a very human experience,
Yes, for
especially when
sure.
there's so much unknown and uncertainty. And when you have actually reached the level of experiencing an anxiety disorder, what's the difference?
Yeah, the main difference is your ability to function, right? Like if you are so overcome with worry and you're not able to do your daily tasks or you're not able to focus, whether that's at work, at home, with family or friends, because your mind is so taken by these worries, they're so big. That's when we're thinking, okay, maybe this may be something more than just a little bit of anxiety, a little bit of worry, which is natural, right? We know that as humans, we have anxiety and worry. It's a protective factor, right? This idea of fight, flight, freeze, or flee, right? That's normal. But when it impacts our functioning, that's when we're talking about something a little bit more.
So, are there any other signs that someone might be on the lookout, either in themselves or in a loved one, to determine if they might have reached that point and they could use some support?
Yeah, definitely. I would say if there's physical symptoms, if you're a little bit more fidgety, jittery, if your heart rate is beating fast, those may be something that you can notice, and also a loved one, a family, a partner, a friend. But also, if you're feeling really hypervigilant and you're on edge and you're, a little bit more physically aware of your surroundings, and you're expressing that, like, well, I don't know if I should be doing this, and the shoulds can come in loud, right? Like, well, I don't know if I should be, what does this mean? And just being able to verbalize that, and it can seem alarming to family and friends. It's like, well, wait, you didn't used to be like this, you weren't verbalizing statements like this in the past, like maybe we should talk about this a little bit more.
That's so helpful to know exactly what to look for in order to guide someone to support or to know if you might need support yourself. So, thank you for that.
Yeah.
There are lots of different ways that anxiety seems to be managed, both with professional help and self care. Can you touch on some of the different ways that anxiety is managed and cared for?
Definitely. So, I mean, with us, from a perinatal mental health perspective, we really want to give you tools, coping skills to help you get through these moments, right? And so that can be learning relaxation skills, because we also know that anxiety can manifest in physical symptoms, right? So if your heart rate is beating out of your chest, you're not going to be able to try to adjust the thought process that's going on in the brain, right? So we want to teach you calming relaxation skills, which can be breathing, which can be practicing meditation, encouraging clients to go to yoga, and really focusing on those physical symptoms. But then also on the therapy perspective, learning coping skills, right? So a little bit of that. Well, is there evidence to support this anxious thought? Let's try to process through and think if there's another way to look at this, right? Because it's this idea that we often think that all of our thoughts are fact and they're based in facts. And that's not always true. Sometimes our brain makes us feel a little bit more worried and a little bit more concerned when actually there's not evidence to support it. So being able to understand the connection between our thoughts and our feelings and our actions, and thinking, well, wait, is there another way to look at the situation that can maybe make me feel a little bit less worried?
So there's things that people can do physically, and there are things
Mhm.
that people can do to reframe their thoughts and almost question their thoughts in a
Yeah.
way. Yeah.
Yeah.
And so I've worked with people who are also taking anxiety medications, and sometimes
Mhm.
they're concerned, like, is this going to impact my ability to conceive? And they're not exactly sure what to do. So if someone comes to you and they've been
Mhm.
prescribed anxiety medications, and they're concerned about how it's going to impact their TTC journey, what sort of advice do you give them?
I tell all my clients who consider medication or who are on medication, write down all your questions and concerns and talk to your prescriber, because there are prescribers that specialize in perinatal mental health. So they're the experts. Any concerns that you have, write them down and have that conversation, because it's valid. And especially depending on the client population that you're working with, there may be cultural factors, societal factors that really impact your thoughts around medication and using it to help treat a mental health condition. So, feeling comfortable and having a space where you can talk about those fears and kind of process, it's awesome.
Oh, I love that. Have a conversation. That feels so
Mhm.
important. I
Yeah.
definitely think that there can be this feeling that your prescribing provider is an authority figure. And like, if
Mhm.
this is what they've decided for you, then you either just go along with it or you make a different decision, but you never have the conversation. So you're kind of like hiding your choice. But
Mhm.
you have a right to talk to people, and people want to support you. They want to help you do what is best for you. So have that conversation with your provider. You don't have to make a decision and hide it. Please don't.
Yeah.
And you also don't have to just kind of like go along to get along. You have a right to collaborate with your provider. So,
Yeah.
love.
And acknowledging that you know your body best, right? So let's say you start taking a medication and you start to develop side effects. That can happen. And talking to your provider about, well, should I reduce my dosage? Should I try something else, right? Just being really open and honest about your experience So we can work collaboratively to make sure that you're feeling like your best self.
Beautiful, beautiful. Thank you for that. Now,
Yeah.
there are a lot of misconceptions about mental health out there in the world. Is there anything in particular that you would love to clear up, especially as it relates to fertility and mental health?
Yeah, definitely. So I think this idea that addressing your mental health or seeing a therapist makes you weak, right? Like feeling like you should be able to burden all of these things on your own, especially when you're thinking about the intersectionality of cultural experiences, societal experiences of being a woman, right? A birthing person, and thinking, well, I have to be this strong individual that should be able to do this on my own. And that's a narrative we really don't like, because you shouldn't have to do it on your own, right? You can build a support system and you can talk about these things, because it can feel isolating, especially in the realm of trying to conceive and managing a diagnosis of infertility. People don't talk about that. And so you may feel like, well, I'm the only one that's going through this. Why would I talk about it? Why would I share this? And that's just not the case, because we know that infertility impacts so many people, and you don't have to do it alone.
Definitely not alone in it. You've given us so much great information already, but I'm wondering if there's anything that you didn't have a chance to touch on that you would love for viewers to walk away with today.
I would say really trying to identify your support system during this time, whether that's, a perinatal mental health therapist, whether that's, friends and family or a partner, or even joining a support group, right? We know that this is hard, and acknowledging that you can do this with support is so important.
Agreed, wholeheartedly agreed. And that's actually why I'm super excited that we are partnering together to provide a TTC fertility yoga and support group, which will be happening in October. So it's going to be amazing just to have that support from other people who are experiencing a very similar challenge, as well as two mental health providers and myself leading people through yoga so that they have tools and they know that they're not alone. So that's one way that people can get support. And that's one way that people can connect with you. Are there other ways that people can connect with you and your work?
Yes. So you can find us at our website, www.crescentandcrown.com, and on social media. We are on Facebook, we are on Instagram, and we're even on LinkedIn. Just search us, Crescent and Crown Therapy.
Love it. One day I'll have to ask you where the name came from. I've always appreciated Crescent and Crown as a name, but I've never bothered to
Yes.
ask. Yeah.
Yeah. I mean, well, so thinking of perinatal mental health, right? So the phases of the moon are often compared to the phases of conception and pregnancy. And the crown piece, we really wanted to highlight those struggling with infertility, because there is a saying that if you are struggling with infertility, you can consider yourself and try to be like a pineapple, right? Hard on the outside, sweet on the inside, and wearing your crown on your head.
Oh, that is beautiful. What a lovely way to end this. Thank you so much,
Yeah.
Lyla. I will make sure to link to your website, your Instagram, and your LinkedIn. Didn't know about the
Yum.
LinkedIn. as, as well as the registration for our support group and yoga classes. So make sure to look in the description box below. Thank you again.
Thank you. Take care.